Before we start, we're going to have a question and answer that's going to be part of a discussion we'll be kicking off after the speakers. So if you can look in your chat box, which is in the center at the bottom of your screen, if you have questions as the program is rolling along, please feel free to put them in that chat box, and then we'll be able to organize the Q&A. So my name's Kim Wilson. I'm the director of the Labor Education Center. And as I said, we're part of UMass Dartmouth. Thank you for joining us at this important discussion. Before we begin, I would like to state the support of the Center for the organizing and the action in the struggle for racial justice and for the humanity of Black people. Tonight, we will learn from the workers and the union leaders who have done the work to take care of those stricken with COVID-19 and the critical workers who've ensured our access to food. So they are not only heroes, but people who deserve all of our respect as workers and as union members. We also need to honor and remember those who work without the protection and advocacy of being a part of the collective power of the labor movement. So before we get started, I just want to thank our labor extension specialist, Camille Viveros, who will be the moderator tonight. Jim Snow, who's done much work on outreach and working with the media, and as I'd mentioned earlier as well, Aaron Waslevek. So the Labor Ed Center, we're able to offer this program because of the support of our steering committee, advisory board, and of course, the University of Massachusetts. So first, we will hear from a member from the United Food and Commercial's Local 328, Dana. So Aaron will begin. We'll have 1-minute videos, and then we'll hear from speakers from the unions representing those frontline workers.
Hi, this is Dana Tao from Stop and Shop. Can you tell us how your job has changed with the coronavirus?
Well, some of the biggest issues we're having is, especially from a customer service standpoint, is understanding customers now that we have masks on. The workload seems a bit difficult. With wearing the masks, you get warmer, you feel like you have to take more breaks just because to cool down a little bit, and if it gets too congested with the increased amount of customers in the store. Every morning, we stop by sanitizing the department. That goes from every U-boat handle we have, every hand truck we have, every scale, any kind of touchable surface that a customer or employee would come in contact with. We have to start sanitizing that, not only every morning, but we also do it on an hourly basis throughout the entire department. So given that, it's a very time-consuming task that is already on top of your regular tasks of maintaining the department to give the customer the freshest quality possible.
And how do you feel this will affect your job going forward?
I feel that how we're operating now will now be the new normal, where social distancing to customers, sanitizing on a regular basis, difficult supply chains to deal with when ordering specific needs and not getting them, trying to get that across to the customer that this is our new normal of how we unfortunately have to operate, dealing with what we have in front of us.
All right, well, thank you very much. It was great to hear from our rank and filer, and I'm going to turn things over to Tim Melia now, who is the president of United Food and Commercial Workers Local 328.
Thank you, Kim. Thank you. It's an honor to be here this afternoon. First and foremost, I just wanted to say how proud I am of my membership and how they've stepped up during this pandemic. They were kept open as essential businesses and had to report to work every day. And they have just done a stellar job in going in there, knowing that they were on the front lines of this. They were keeping their communities fed and taking care of themselves, trying to take care of themselves and their families at the same time. It's been a rough few months for those folks in the stores. We had to deal with right away with the companies to address certain issues that we hadn't addressed before that never had come up, especially trying to get protective equipment and making sure that all the associates stayed safe during this pandemic. We fought with the company long and hard, trying to make sure that there was social distancing there, that there was sanitizer in the stores, that things were being cleaned properly. All these things that we were working with the company to try to achieve. At first, the company had said to us that they didn't want the associates in the stores to wear masks, because they were afraid that they would intimidate the customers or frighten the customers, that by going into the stores it wasn't safe because the workers had masks on. And we had to push back hard on the company to allow them to continue to wear these masks in the stores. Some of the first things that we tried to do was we tried to get the workers designated as frontline employees, because we were having a hard time getting personal protective equipment. And if we get them designated as frontline employees, we could get the PPE equipment, we could get them testing, and we could get them child care that they needed. Because a lot of the things that we were dealing with was people couldn't go to work because the schools had closed, and now their kids were home alone, and they couldn't leave their kids home alone, so they had a problem there. The other problem that we were dealing with was in the stores as well, was that we had a lot of older folks who were senior citizens who worked these jobs as kind of a second income for themselves, who were especially at high risk to contract this disease, or for members who may have had underlying medical conditions that would put them also at a high risk of contracting this disease. So we worked with the company to allow them to take a leave of absence, and we wanted to make sure that if they did take a leave of absence, if it extended for any great length of time, that the company would guarantee that their jobs would still be safe. So the company did agree to do that and keep them safe. So that was a very important thing for us to do, to try to make sure that we could protect the members in the stores. One of the first things we negotiated with the company right around mid-March, we got the company to agree to pay hazard pay to the folks working in the stores. Stop and Shop agreed to give everybody a 10% pay increase. Other companies such as Amazon, Shaw's, other retailers in the region, they were paying their employees $2 an hour above their wage. There was a little difference in how both companies were doing it. Stop and Shop, even though they were doing a 10% wage increase, they applied that to all hours worked. So if they worked Sundays, or if they worked over 40 hours in overtime, that got applied to their overtime as well. The $2 an hour that Amazon was paying was only for the 40 hours. So if you worked 50 hours that week, 40 hours was at the $2 over your rate, the other 10 hours was paid at your normal straight hour time. So there was a bit of a discrepancy there. One of the things I can say about Stop and Shop kind of set the trend in the industry in a lot of ways by what they were doing. Again, we're trying to work with us to make sure that everybody was staying safe in the stores, but they were one of the first companies to come out and say, okay, we're going to put the one-way aisles in the stores to protect people. We're going to put the plastic shields at all the registers to protect the cashiers. They were allowing the cashiers to take multiple breaks during the course of their shift, so that they could go to the bathrooms and wash their hands and sanitize their areas and clean their areas. So they were willing to work with us in a lot of areas there that helped to keep everybody safe. But this didn't relieve the anxiety of the folks working in there. Early on, our international union did a polling of our membership, and the numbers came back that 94% of our membership surveyed who worked in retail food were extremely concerned about contracting this virus. It was very early on in this pandemic. We didn't know how it could be contracted on surfaces or through the air. So one of the first things the company did, because they heard that it was being contracted in the air and they couldn't get the PPEs, was they provided face shields for the employees. And a lot of you see these face shields, healthcare workers were wearing in the hospitals. They were just a plastic face shield that looked like almost a welder's mask, because even the company was having a hard time getting the PPE. And they got those right away, but luckily we were able to get a hold of a company out of Wisconsin. It's the American Union Embroidery and Screen Printing Company. And they do a lot of our union printing as far as the logos on our shirts and the stuff that we give away to members that has our logo on it. They do a printing. They had a connection with somebody in China, and they were getting PPE products sent over to the United States. So we were able to work with Stop and Shop and hook up with them and connect with them that Stop and Shop was able to get 1 million surgical masks brought over for the people working in the stores. And this was very important early on. We wanted to make sure that these people were protected. Along with that, our local also purchased 15,000 of these masks because we have other industries that weren't able to get those, so we purchased them on their behalf, and we distributed them to our nursing homes, our other supermarkets that we had, our cafeteria workers who were still working at the time, and school bus drivers. So we were able to get the personal protection equipment to them. Our sister local, 1445, had a connection with a company called MS Wallace, that was a liquor manufacturer who was or a distillery. And what they did was they had switched over and started making hand sanitizer. So we connected they connected them with Stop and Shop, and Stop and Shop purchased all their hand sanitizer through this company to provide it, to have this in the stores, because everything was flying out of the stores at the time. When this whole thing hit, as you know, there was a rush on the supermarkets. And people were working as many hours as they could in the stores. The overtime was not an issue in the stores. They wanted people to stay and work. They had a problem because of the people who did decide to take a leave of absence. They were shorthanded in a lot of stores. So they were trying to hire people, as many people as they could hire. And the company at one point actually shut down one of their home delivery systems, their e-commerce sections, because they couldn't keep up with the demands in the stores. At one point, there was a 40% out-of-stock position by Stop and Shop in these stores because of the run on people. As you know, toilet paper was a big thing. All sorts of cleaning products were big things in the stores. So these were things that we were dealing with in the stores. What the company was doing, too, is they needed to close down service departments because they could not guarantee that people would not be exposed in some of these delis, seafood departments, and bake shops. So they made a decision in mid-April to close down their service departments, and they went to a system of grab and go. But one of the things that we had to make sure was if they're closing down these departments, that our members would not be laid off and hurt by that. So the company guaranteed us that they would keep these people working, and they did. What they did is they had them cleaning in other parts of the store because there was constant cleaning going on. They had them working in the delis doing slicing the cold cuts ahead of time and pre-packaging them ahead of time and using them as what they call grab and go, so it was just out there for the customers to take. So that's what they were doing, and they were working in other departments and supplementing the help that they needed in other departments. So that's what was going on in the stores. Also, the other thing that we were pushing on the state and the federal level was to control the amount of people that were coming into the stores. We're getting a lot of feedback from our members that customers were not maintaining social distancing. So we pushed hard on the states and the federal government to put limits on how many people could go in the stores. The state of Rhode Island was the first one to come out within our jurisdiction, and they put a 20% limit on customers going into the stores in Rhode Island. Massachusetts hadn't been doing it yet. We were pressuring Governor Baker to do the same thing. It took him a few more days to come around to that, but they did agree to limit the amount of customers that could go into the stores. Unfortunately, in Massachusetts, he put the limit at 40%. So that allowed many more customers to be in the stores at one time than it did in Rhode Island. Some of the stores had a maximum in their stores, anywhere from 200 to 250 customers were allowed in the stores at one time. So it didn't really alleviate a lot of the problems we were having with the customers and social distancing. So in mid-April, our UFCW decided to do a campaign, a nationwide campaign called the Shop Safe campaign. And we did a blitz through social media. We did ad campaigns that we were asking customers to do some things while they were shopping in the stores. We were asking them to wear masks, and we're asking them to keep social distance away from people, the workers especially while they were working. They also asked that they not bring in the whole family while they were doing their shopping, to limit the amount of people that they brought with them shopping, just to send one person into the store at a time. And this was received very well by the customers. We had customers who took pictures and posted them on our social media websites in support of the grocery workers with their masks on, showing support for the grocery workers there. So we were very pleased with that, and we've continued to push that campaign, and we continue to push to ask customers to maintain that social distance for our members. There are little by little things are starting to loosen up inside the stores now. Within the last week, the company has decided to reopen those deli departments, to reopen those seafood departments or service meat departments that they had closed earlier on in the pandemic as things are reopening. So things are loosening up in the stores a little bit. So one of the things that we're working on right now is throughout the UFCW, we are basically pushing these companies, especially companies like Stop and Shop, Shaw's, all our union companies, as well as the non-union company, Amazon, these large corporations that have been paying hazard pay to people, to continue to pay the hazard pay. We feel that as long as people are in the stores and they continue to wear masks, they continue to have to social distance, they continue to have to sanitize their areas and clean the stores several times during the course of a day, that they should receive hazard pay. They are still on the front lines. They are still in a hazardous situation. And so we are campaigning very hard with these companies to maintain that hazard pay. We have teamed up along with everybody in Region 1 and UFCW, which consists of New England, New York, and New Jersey. We are been pressing and meeting with Stop and Shop and other companies to assure that they would continue to travel to pay the hazard pay. Presently, the hazard pay is set to expire July 1st, and we're asking them to continue this as long as this pandemic continues. We're also working with on the state level and federal level. We are up at the State House sponsoring bills right there. The House Bill 4739, which is allows for workers' comp for anybody who contracts the COVID-19 virus at work, that they can claim workers' comp and collect workers' comp under that law. And we're also supporting House Bill 4745, which is hazard pay for essential workers. So those are two bills in the state of Massachusetts right now that we are sponsoring and working on to try to get passed at the State House and the state level. So that's where we are right now. That's what's going on with the UFCW. Thank everybody. I'd like to thank you all for having me on today, and thank you for your support of my members in the stores when you go in there. I know a lot of members have told me that other union people go in there and thank them for the job that they're doing. So I just wanted to thank you for that. So thank you. I'll answer any questions.
So thanks so much, Tim. So for folks that aren't aware, right, the healthcare sector and retail grocery are two of the largest sectors of the economy, and also representative of largest elements of our union movement here. For example, at the Greater Southeastern Mass Labor Council, the UFCW is our largest affiliate. So, you know, I wanted to, folks haven't done Zoom calls before, don't be shy at thanking some of the speakers that we're hearing from. You have a reactions button so you can applaud. we already have some great questions that we're going to hold to the end, but we want to make sure that we hear from Frontline and also labor leaders around how you've been able to deal with this crisis, right? All of us have heard many, many times, stay at home. And we're hearing today from people who really were the people that didn't have that option, that had to think twice about how they needed to be there for us to keep us healthy, keep us fed. So we're going to move on to our next speaker from the Mass Nurses Association. We're going to hear from a rank and file worker, and then we're going to hear from the president of the MNA, Donna Kelly Williams.
It's a really scary thought to think about all the ways that I could be picking up the virus, even with all the protective equipment that we have. Every time you go in a room, you have to remember to put the gloves on the right way, to make sure you have your mask on, to make sure you have your shields on, and just remembering all those pieces of equipment before you even step into the room is daunting. Without a union, we would be not as well protected, and we wouldn't have the voice to be able to get what we need. It's pretty awesome when you're on a call with management and there's 30 plus people from the committee on the call. And we're all there and we're all strong and united, and to back each other up and say, no, this is going on. You may not know about it, but we know about it, and this is what we want.
Oh, thank you very much, Amanda, for talking about what it's like to work in one of our newest bargaining units, which is down at St. Luke's Hospital. I do want to talk about the fact that we are 84 days since the beginning of the shutdown. So over 100 days with knowledge of this coronavirus and what the potential impacts could have been to everyone. And I'm very sorry to have to say once again that our biggest fight is we continue to fight for the right PPE or personal protective equipment. First and foremost, as registered nurses and nurses on the front line, as well as other healthcare professionals that we work with, we're trained in infection control as well as trained in what equipment we need to prevent circulation of certain viruses and infections, bacterial infections. We're drilled on it, we're tested on it, we have to prove that we're competent in being able to do all of those things. And you can imagine the horror that we felt when the CDC, which is the person that we all rely on to keep us safe, was lowering those standards to accommodate how many N95 masks they had, how many sets of gloves they had. And to this day, we continue not to have the equipment that we so desperately need this far into this pandemic. So first and foremost, I do want to talk about the most important thing. One of the most important things that we did was really differentiating what the difference is in the different types of PPE. So if you are on the front line and taking care of a patient who has the COVID virus, the best protection that you have is the N95 mask. And that's the mask, I have one right here just to show everyone. It's the one that's almost like a cupcake. It fits very snugly to your face. And that prevents any of the virus from coming into the caregiver, the person that's taking care of them. You see now masks in different arenas, because everybody is supposed to be masked, where you are going to see a mask like this or a mask like I wear with my grandchildren, which is frozen, that those masks actually will protect someone else from getting the virus from you, and will also give you some protection if you come within so many feet of an infected individual. We should not be at this point in the pandemic still trying to seek the highest quality of PPE, but yet here we are. So we continue throughout this whole pandemic by writing letters to the governor every week, telling him what we were seeing on the front line of patient care, as well as being on the phone with both the Attorney General and Mary Lou Sudders, informing them of the critical situation that we were seeing at the bedside. And just as we heard just a few minutes ago, many people were told not to wear a mask at the onset of this pandemic because of the fear of scaring patients or scaring clients, when in fact, that was probably when we saw some of our highest spreading of the virus, was when we did not have people that we knew needed to be protected, not protected, and not masked. And it wasn't just in the hospitals and the acute care arena, but we also saw it in long-term care. And then we realized that some of our soldiers' homes, they were not equipped to deal with the virus. And then we saw it go even further to some of our group homes. So it's terrifying to think of how at this point in this pandemic that we're still looking to have the highest standard in place right now to protect us, because we know that we are right on the verge of a potential second surge of this very virus, and we need to be prepared going into the fall that we may see a second reoccurrence of this. So we have to be very, very careful with this. So one of the things that we had to do was in all the regions of the state, we do CE programs, or continuing education programs, so that we bring nurses together, we tell them about what's new and important for them to know in their practice. We had to cancel all of those programs that we offer, and instead we utilized those resources into purchasing PPE. We went everywhere that we could to try and purchase masks so that we could distribute it to our members. We bought over 100,000 masks anywhere that we could. We have an occupational hygienist that's on staff that's certified that those masks that we were able to acquire met that standard that they so desperately needed at the bedside. The other thing that we did was, in protecting our workers, we sounded the alarm very early on. As soon as we heard about the Patel cleaning machine opening up over in Somerville to decontaminate masks, we let everyone know that we had great concerns about the lack of research that had been done on the use of vaporized hydrogen peroxide to decontaminate masks that were intended to be disposed of. The masks, the N95 mask, is a mask that is manufactured and intended for one-time use. Nurses were using them over and over again, some of them up to 3 weeks at a time. So they had lost their shape as well as their ability to fit very tightly on someone's face. And then after that 3-week process, they were dropping them into a bin that then went over to the Patel decontamination chamber, and then were supposed to be returned to them to put back on their face for 12 hours without any research as to what the off-gassing or the long-term effects of that, wearing that mask. So we have a mask that's been decontaminated. We don't know the long-term effects, facing a virus that we don't know what the long-term effects of this virus are. We have learned so much, and every single day we learn more about this virus, and we need to be very cognizant, very, very cognizant of what is ahead. I applaud many of the workers that were able to get an employer to agree to allow for workers' compensation for when people acquired the virus in their workplace with that assumption. However, many of our members have been told by hospital administrators that they must have contracted the virus in the community if they had come down with the virus. As of a month ago, the data that we collected a month ago was approximately 2,200 frontline nurses or healthcare professionals in the hospitals had been tested. 2,200 had been tested positive, excuse me. We know for a fact that there is many, many more, because at the very same time we surveyed our members during a Facebook Live that I was doing, and found out that 79% of our members had never been tested as of a month ago. So we have a lot of work to do with that, and those were some of the things that we highlighted to the governor, and we certainly have stepped up our testing. But our concern with the testing is the quality assurance that the testing is actually as accurate as it needs to be. We've heard so many issues with some of the testing being shown to be false positive or false negative, as well as the testing and training of the testers was not adequate enough to get an adequate supply to be able to test. So we have a lot of work to do. And unfortunately, I think one of my greatest concerns was when we started to look at the numbers going down and looking at the reopening, that the advisory committee to the governor did not include the very frontline workers that are here today. That was something that was greatly overlooked and definitely needed to be part of the plan. We're very fortunate that some of the mayors that had been involved in that advisory committee actually took many of the notes that we had done and the recommendations that we had and brought those forward. So I do want to talk about how was the workplace impacted. We had many hospitals that furloughed nurses or laid off nurses as a result of them not being able to do elective procedures, which is somewhat the bread and butter of the corporations of hospitals that we have right now. Hospitals are not in the business of giving healthcare. They're in the business of making money, unfortunately. And that's what we're seeing more and more of. So we have to get back to the business of providing the highest quality of healthcare that we possibly can. So as a result of those furloughs, what we had was a lack of resources at the bedside of patients. Some of the research that we heard about halfway through the pandemic was the ability, for example, of proning a patient to prevent having to put them on a ventilator to assist them with breathing. That in itself, that procedure takes 5 to 6 people to take one patient and turn them from their back onto their stomach to allow their heart to rest and their lungs to be opened up. When you furlough a number of your staff and you don't have the ability to have the resources to do that very technique that has been proven to be good and useful in fighting this pandemic, you have to resort to intubating or putting patients on artificial respiration. So we need to look at what we know works, what the research has shown us, and what resources we need to have in place. Another concern that we have been raising the alarm consistently about was the closure of essential services across the Commonwealth. So in the midst of this pandemic, we've had Cape Cod and the islands announce that they were closing both their maternity and their pediatric units. We had hospitals across the state that were closing their behavioral health units. And every single one of these has an impact someplace else. So without the proper notification, the proper planning, the proper enforcement of the ability for the Department of Public Health, who holds hearings on the closure of these services, who then deem these services to be essential in the communities and need to be continued, yet the corporations just close them anyway. So we need to ensure not only with some of the legislation that has already been talked about with the presumption of occupational exposure, but we also need to be given DPH the tools that they need to enforce the highest standards of care, as well as the tools to prevent the closure of the very essential services that we need going forward. So I think I will close there. I'm sure there'll be lots of questions, but once again, I just want to thank everyone on the call for all of their help. I think that this is yet another example of how our working together it has been very instrumental in ensuring that we will all survive this. So I thank you for this opportunity.
Well, we thank you so much, and the questions keep coming in. So now we're going to hear from 1199 SEIU, United Healthcare Workers East. We're going to hear from a frontline worker and then from the Vice President, Jerry Fishbein.
Hi, my name is Jean-Florent Févilier. I have been a healthcare worker since 1994. And the worst time for me is when I got sick and tested positive for COVID-19, and then I was not able to go to work to provide the kind of quality of care I am capable to do. And then the best time for me is when I beat the virus, and then I was able to go back and help my resident and put a smile in their face, and then it's priceless.
Thank you. I was afraid we were going to go through the whole 8-minute video, and I'm glad. Thanks for. I think it's a good spot to stop after Jean Florent. I would just want to mention he's the leader at Courtyard Nursing Home, as you saw, and it's one of the hardest hit nursing homes in the state. I don't know if in May you may have remembered in the Boston Globe reading that 60 residents had died there, over 115 had been infected, and 45 staff members have been infected. As of last night, we've lost about 5 rank and file members to the disease. Before digging into the work and the issue that we have here, I want to stop for just a second and recognize what Kim said at the start of the meeting. It's just critical at this time that, and as a white labor leader, kind of draped in all kinds of privileges that some I know about, some I'm learning about, some I need to learn more about, that it's really incumbent on us to talk, make space for and engage in conversations with our members, particularly our white members, about institutional racism, because we're not going to build a kind of economic social justice movement unless we do. So I don't think we have a choice. So thanks, just want to spend a second on that. Folks, our local represents an extremely broad segment of the healthcare industry. And all of them are represented in this area in the southeastern Mass and the islands. It's primarily, but not only, service maintenance and technical workers. It's in nursing home workers and home care workers. And throughout the last, Donna, I can't believe it's only been that long. It feels like it's been 2 years. But throughout the last weeks and a few months, our experiences have all varied, as you can imagine, within the industry. In hospitals, the requirements for social distancing and the prohibition against certain elective procedures shut down large parts of our facilities, introducing furloughs for the first time. Between 10 and 25% of our membership was furloughed. It's something that's not envisioned in our contracts and hadn't existed before. We ran into situations where there were brand new jobs cropping up, that were necessary and vital. The screeners at the front of the hospitals taking temperatures and greeters also. There were field hospitals and step-down facilities that were created. Again, issues of redeployment came up in each one of our hospital chapters, where the workers go, outside, inside their job descriptions, things under normal conditions we would have a very hard line on in terms of, that's not their job and you should hire people for those positions. We were faced with dealing with that rapidly evolving situation. In nursing homes, there have been a large number of outbreaks people have read about. The nature of the care is extremely close and personal. We've always had staffing issues in nursing homes. Short staffing has been a chronic problem. It's been amplified as members got sick. Residents, remember that residents can no longer be congregated in dining rooms for activities or meals, which means the shorthanded staff are now literally running from room to room to take care of the members. The residents also remember, please, that during this time, family members can't visit. So our partners or our grandparents or our parents don't have any social interaction except for these frontline overburdened staff already. For home care workers, and not all, but mostly, almost entirely PCAs, they work completely on their own. Lisa Lemieux certainly is a frontline expert on this stuff, but their employer is technically the state. It's really their consumer, the person they care for. Consumers weren't prepared for this. They didn't have a supply line or a stockpile of masks and gloves. Sometimes we have a box of gloves, but not the kind of stockpile that they would need for 3 months of isolation and care. At the time of the outbreak, PCAs were not classified as essential workers, and they were often prohibited, sometimes because of the racism in the community, but were often prohibited from going into apartment complexes and neighborhoods where the consumer lived. They have and had little or no protective equipment. So they were both potentially bringing in a virus or taking out a virus. So all of these kind of different experiences, but there were commonalities, of course, with all of them. You know, childcare fell apart. Unlike comic book heroes, healthcare heroes, you know, they got families, and they're often single parents. Childcare centers obviously closed, and even the emergency ones open for frontline caregivers. Were difficult choices for our members to whether or not to take their children to a different setting, not, you know, understanding the rapidly moving virus. They have elder care issues, or members of parents, grandparents under their roofs are concerned they're getting exposed at work. And then PPEs and more PPEs. Donna really clearly outlined this issue. In hospitals, we had patient-facing non-nurses who wouldn't get the correct PPEs. There were we have respiratory therapists working in departments in aerosol, I can't say the word, procedures that create aerosol without an N95. Didn't make sense, doesn't make sense. And we couldn't get the proper care. We have housekeepers going into places where somebody had just been on a ventilator, and again, they were given maybe a surgical mask, you know, at best. In nursing homes, situation, frankly, is horrifying and was horrifying. It's better now, somewhat better. We have pictures of union nursing home workers walking around with plastic bags over their heads and over their faces. It was awful. In home care agencies, we have members who go into private homes to provide care, not like in a hospital where there's an EVS worker cleaning and scrubbing and sterilizing, but it's just an open house. They come to my house, you know, it's not a sterile environment. And there are often lots of other people in the house. We have a story of a South Coast home care worker who went in to provide hospice care, and there was an extended family in the house, coughing, talking, no masks, unmasked people, 20 people in the room, and she had no N95. Personal care attendants, as I mentioned, had nothing and no access to anything. If they had a mask, it was worn over and over again. Maybe it's from the basement, but here really they were frontline caregivers with bandanas, scarf, whatever they could use to cover their mouths. So our union moved to engage in kind of every single forum we could engage in. So there was traditional, mostly virtual negotiations about furloughs. We negotiated furlough agreements, guaranteeing positions when people would come back to, and redeployment. I will say in our area in Southeastern Mass, exception of, as you can imagine, with exception of South Coast, most of the furloughed employees for up to 9 weeks were furloughed with pay. So the pressure was not as severe at that time. It's become more, but with the extension and expansion of unemployment benefits, many of our members were prepared to go out for some period of time. We did workplace and our members engaged in workplace agitation over lack of supplies. A lot of the selfies of we need PPEs. There were standouts in nursing homes up and down the Cape and off Cape also. We've done labor management committee work. The sister from the M&A who was speaking about being on a call, we moved to just about weekly meetings and calls with facility leaderships to impact their plans, underscore our priorities, and address daily issues of workloads, grievances in some cases that were dealt with that way. We also engaged in the state infrastructure. Early on, 1199, we held a presence in the emergency command center, struggling along with our sister local unions to get PPE procurement and distribution, discussing shortfalls of the plans that were being made and trying to address issues like childcare and look for opportunities to provide the frontline caregivers with the supports they would need to provide the care. We engaged, Tim's point, you know, Tim, you're not a fisherman because you give up all your contacts. In terms of engaging with the private sector, we built relationships with manufacturers who were retooling to produce masks, gowns, shields, and connected them directly to employers in many cases. And then procurement. We had staff and union leadership engaged in facilitating procurement and distribution. We distributed over 400,000 masks to personal care attendants through direct mail program and also through distribution, through you know, curbside distribution throughout the Commonwealth. We moved very quickly, and it's been a project for a number of years of our union to move into engaging as many technological tools as possible to assist in our organizing. We've been doing, again, for a number of years. Our staff continue to work full-time, extra time, and Lisa will admit, concede all the time, providing outreach, doing contract enforcement. And while our physical offices were all closed, we were working remotely. We're in constant contact with our rank and file leaders and our members. So in the last 3 months, we held over 500 chapter meetings in Massachusetts. In my area in Southeastern Mass, we held over 40 meetings with about 1,500 members participating in those meetings. There have been 11 meetings with members of Congress where we've had frontline workers from Toby Hospital, from Southcoast VNA, from Beth Israel Deaconess Hospital testifying to members of Congress about hazard pay or what they're calling pandemic premium, about PPEs and healthcare funding. The insulting and dangerous thing that Donna mentioned, where employers were telling hospital workers that when they got sick, they must have gotten it while they were out shopping. All of us live lives of isolation right now and have gone from work, where we do have work, to home. These workers went to work where they were exposed, no question, and went home. And when they came down with the virus, some of our employers said, "Oh, you must have gotten it somewhere else." We testified to Congress about that. We've raised legislation about presumptive exposure for frontline caregivers in Massachusetts as well. What happens next? As we prepare for the next outbreak, as Donna had mentioned, and I think we have to be cognizant of, there's no questions that our industries are significantly changed. We'll come out of this with crippled employers. I don't know how else to talk about it. The hospital industry anticipates losing $5 billion. The federal government has provided about $2 billion so far. Our PCA contracts, one of the best in the country, by the way, is funded by a state which is anticipating a budget deficit that's 3 times as large as the worst deficit during the Great Recession. And our nursing homes have been impacted forever. There's no question that they're under tighter scrutiny, as they should be. We're going to see much more emphasis on home care and away from congregate living wherever we can. In this area, we have open contracts at Toby Hospital on the islands. And on the islands, our major contracts on the Cape are opening up soon. It's going to be very difficult negotiating all these things, but we have to be very clear, and here's where we're going to anticipate needing help and want to have help, is that everyone has talked about healthcare heroes or frontline heroes. You don't take things away. You don't take benefits or wages away, or you don't take reduce working conditions for heroes. We need to support them, and our union intends to fight hard. I know that there have been 9 actions in New York City, where our local has a lot of density and strength, demanding hazard pay. We're continuing to demand that. How can other folks help? We really have to have a federal response. Congress has passed a heroes pay and increased funding for healthcare, and the Senate and 45 are going to kill it. So we need to take that on in a real way. The response to get PPEs needs funding, and also the kind of procurement and stockpiling that I think was talked about earlier. And mostly our members need support in organizing. Organizing in our communities and organizing in our workplaces. Pandemic's made it really clear to us that the safety net in the US is seriously unsustainable. Our childcare system's inadequate. Healthcare tied to employment makes no sense, and we're seeing that less probably in Massachusetts than other parts of the country. And then look, we need to organize on every issue. Climate change will make COVID look like a bad cold, and so we need to organize around that. We're looking forward to building with each of you. We're engaging our members. Last night we had a virtual lobby day with legislators and the governor, with probably 700 members on the call and on this kind of format. There will be times for direct action. We're taking on Southcoast and Toby on their really ridiculous program of earned time and the way they make people use it up when they're out on leave. And so we'll be calling for help on that. So number one, for those frontline folks on the call, on the screen and then in this chat room or whatever, thank you very much for everything you've been doing. Tim, your members are amazing and strong. Donna, your folks are just leaders. And the other people on the call, thank you for standing with us, and let's go and build a movement that can address these issues. Thank you.
Thank you, Jerry. And we're going to talk a little later about ways that we can support. We already heard some calls to action, some legislation, some deadlines for us to really figure out how we can build solidarity around. I mean, we've all seen the commercials. We've heard about the applause and how there's a sentiment of appreciation, but we really want to take some time during this meeting to turn that into action and to plan next steps. But we wanted to, before Lisa Lemieux, the president of the Greater Southeastern Mass Labor Council, moves toward the closing and we have that general conversation, we wanted to take a few moments to allow for any of the press on the call to ask any specific questions. You know, we want to amplify the voices of frontline workers, so we want to make sure that any questions that you have get answered, and then we'll get into the general questions. So I know we have at least one person on the press. If there's anyone else, you can either raise your hand or in the group or send a message.
Cindy McCormick.
Okay, Cindy. So let's make sure, Cindy, thank you for joining us tonight. We wanted to make sure you get any questions answered, and thank you so much for covering this issue. So please feel free to ask any directed questions.
Yeah, thanks, because I have to start writing now. I'm on deadline. I wanted to ask Jerry and Donna what's happening at Cape Cod Healthcare with the furlough. It was supposed to be over. Is it over?
Nope, it's not over. My understanding is that some have been called back, but again, when I mentioned about the essential services, there was a hearing just a few nights ago regarding DPH hearing about the closure of those two facilities, pediatric and obstetrical units. That's a great concern to us, especially given the timing of it and the training that's involved in training and having people at the ready to care for patients, not only during a pandemic, but at crisis times in their lives, whether it's when a child is sick or the birth of a child. It's one of those things that just absolutely doesn't make sense at all. And I've watched very carefully what's been going on at Cape Cod Hospital because I'm the proud mother of an emergency room nurse at Cape Cod Hospital who started her career there 5 years ago. And I was very, very disappointed knowing what I do know about the great work that the staff does at Cape Cod Hospital, to hear about the changes with the furlough, the changes within the facility of closing essential services. It was very disappointing to hear that. Hospitals, despite having been given a great deal of money to help weather this storm, every individual has been put in a very difficult position as a result of this pandemic. We will weather this together, but we can't be weathering it by closing essential services that are deemed as necessary for the protection of communities. So I'm very, very disappointed in Mike Loff and the Board of Trustees at Cape Cod Hospital for taking this egregious step and not protecting their workers in a much better way than they have shown. Jerry, I'll let you take it from there.
Sure, thanks, Donna. Thank you. Hi, Cindy. So we had negotiated an agreement on the furloughs when we saw them coming. We knew that there would be, so we put some parameters around it. They were required to notify us after 21 days if there would be an extension of the 30-day furlough. So we were notified that for the bulk of the members, it would be extended. Having said that, there are a number that are being recalled to each of the facilities where there are furloughed. Probably the largest percentage of those are to the lab services. I won't say the largest number, but the largest percentage in terms of the laid off folks or furloughed folks, not laid off. Mm-hmm. And then it was extended for another 30 days. There's no contemplation at this point of an extension beyond that. And our agreement was that it would be that a decision would need to be made. We didn't want folks, and our members insisted that they wouldn't just be held dangling, you're furloughed forever. They wanted to know. The minute we found out who was going to be called back and that people were going to call back, we obviously texted it out, blasted it out, emailed and called people to let them know. So short story is, number of people coming back, not nearly enough. But a number of people are coming back starting Monday as some of the OR and other services open. And then the rest and the bulk of the members will continue to be on furlough.
And how many would you say will continue to be on furlough?
Cindy, I can pull that up in about 30 seconds if you want to go on, and maybe I can text it to you, or if we're still on, I can.
Yeah, you can. If you can text me, that'd be great, because I do have to get off now.
I'm a little bit worried about my technology, but I'll look for it. Just have a second.
Yeah, if you can either text or email to me, that would be great, because I do have to start writing now. Okay. Thank you very much. I appreciate it.
Thank you, Cindy.
Thank you for joining us.
Thanks.
Mary, would you like to ask any specific questions? I think we have Mary from WBSM here. You'll need to just unmute yourself if you want to speak. Otherwise, we can move on to the group conversation. Okay, well, if you change your mind, feel free to unmute. We've already unmuted you on our end. So we heard a lot about different conditions, and just going down the chat, there's a lot of thank yous to our speakers, to the workers that are members of the unions represented here tonight. There's also some concerns about the public's more lax attitude around precautions that we should be taking going into grocery stores, and also some of the standards as we're moving into, as the UFCW workers said, the new normal. So if people have any specific concrete calls to action, I know we've heard some concerns about furloughs. We have the July deadline around the hazard pay and the pandemic premiums, right? So why don't we start with going around and, right now is an opportunity. We have some community members, we have some faculty, we have different unions on the call. We want to hear, again, it's okay if you've said it one time, but what can we do? What can we do as a labor movement? What can we do as a community? Small, big, right? Anything from what do we do when we're, with loved ones who are ill, versus what do we do when we're going into grocery stores, to what do we do at the congressional and federal level and on the local level. So wherever you'd like to take it, let's go first with Tim, then with Donna, and then with Jerry. Once again, what else would you like us to reinforce with in the coming weeks? What actions can we take? And then we'll move on to a closing with Lisa. And there also, amongst the chat, we've heard some interest in doing this again, right? Because we know, as we all said, we're not at the end of this struggle. So so let's do another round of calls to action, next steps that you would like us to take as a labor movement, as community members. And we'll start with Tim.
Thanks, Camille. As far as the next action, I think it would, right now, it's going to be on the hazard pay continuation. We've put a campaign on, and we've notified Stop and Shop that if they don't continue to do this, that we are going to put a heavy campaign very similar to what we did during the strike a year ago. Social media, public opinion, and we will embarrass them in the media. So we will be doing something if after July 1st they refuse to continue paying the hazard pay. As far as in the community and what you can tell folks in the community as far as when they shop is, again, Deb and Jim had put a comment up that I read about one of you were in the Somerset store, and people weren't going down the right aisle. They have the arrows on the aisles to direct you which way to go down the aisle, so that supposedly to keep some social distance between the customers and the workers as well. People are not abiding by those, and the company has told us that they are not going to enforce that. If somebody goes down the wrong way, they're not going to go after them or tell them they can't do that. Same thing if they come in without a mask on in the store. The company is not going to stop them from coming into the store. They have signs up that say, we suggest that please wear a face covering before you come into the store, but they're not going to stop them. My concern was when that first happened about face coverings was I didn't want my members being the ones who had to go tell the customers and get into a fight with the customer over the fact that they didn't want to wear a face covering. And I think that should be better left up to the company to enforce that and their security people in the stores to enforce that. So we are still fighting with the company over that, trying to get them to enforce these things, especially the social distancing. And you know, if you can encourage people in the community, if we can encourage them, again, wear a mask in the store. You know, give these folks a break in the stores. They're trying to do the best they can. They're trying to order the product. They can't get it. If they had it, they'd put it on the shelves. The toilet paper, the cleaning supplies, and things like that. They're doing the very best they can under strenuous circumstances and many times. So if you can limit the amount of people who you take in with you into the stores, like I said earlier, those are the best things that we can do as a community to support those workers in there and to help them out and to make their workplace safer. So if we can do that, that'd be great.
Thanks, Tim. We have a question from Jim Snow about asking Tim, is manpower an issue at Stop and Shop right now?
Luckily not right now. My numbers, I just got my membership numbers this morning. I am down a few hundred people in the store from where I was back in March. And those numbers, I think, primarily are people who have taken leave because they don't feel safe working in the stores. Most of them are, you know, I think I said earlier, I have a lot of elderly folks that do work in the stores who aren't feeling comfortable working in there. And some people are just not, you know, aren't ready to come back yet. One of the big issues that they're having right now, especially on the Cape and the islands, is they're not going to get the J1s that they normally get to supplement the help that they need in the summer with the influx of tourism going to the Cape. So what they've done is they've actually raised the starting rates in the stores as high as $17 an hour to start in these stores to work, to attract people to come and work at these stores. So they are hiring. They'll take anybody for night crews. They're taking people in the warehouses. They're taking people to just work in the stores in general. So they are a little lower than they normally are right now. So if anybody's looking for work, and we have put that out there all along, that if you're looking for work, the Stop and Shop is hiring.
How about, you had mentioned the sanitation, you know, how there have been additional breaks and some changes in the workforce, but how about with the additional work of the sanitation, how has that affected hours or the workforce?
They've actually added hours in that respect onto the workforce to actually have crews going around the store just cleaning. And that's what they'll do. So they said, you know, we're not going to lay anybody off. We're actually adding hours in that respect. You know, throughout the day, they go throughout the entire store, wiping down end displays, making sure the carriages are clean. They're told to make sure the carousels, the cashier carousels, are clean. The touch pads that you use for your credit card, that they're cleaned many, many times a day because there's so many people touching those. So they have added hours onto the schedules for people just for cleaning purposes. So they are trying to stay on top of that. And people are instructed within their departments. There's certain protocols that they're required to follow now within their departments to make sure that the departments are cleaned several times a day during the course of their schedules.
Well, we're still inspired by the strike that you all did, and so we know if it's anything like that, you know, they should really capitulate to your demands now. But we stand ready to support you. We're gonna send in the chat box the email and the website for local 328 UFCW. Thanks so much, Tim. We'll have some other questions toward the end, but Donna, what are some calls to action that we can, that you'd like to emphasize, or some calls to the public, to your union siblings, that we can show some solidarity? What can we do right now to support some of the struggles that your workers are going through?
So I think one of the highest priorities right now is legislatively to get the presumption of occupational exposure passed. That impacts so many of the very people that we put in harm's way, really, on the front lines of caring for others without the equipment that they needed. So anyone that can get the information out, you can certainly go to our website. I'm sure 1199 has it up on their website. Everyone probably should have it up on their website, is to make sure that you are making those calls to the State House to get these important documents, these important regulations passed, so that we have some enforcement mechanisms. I'm so frustrated by the number of times we've tried and tried and tried, and even when we get something, that we don't include an enforcement mechanism. And that's what we need going forward. Enough's enough of the kisses and promises. We need enforcement. And that's one of the strongest things that we need to enforce. Is you cannot be putting people in harm's way and then walk away from it and say, well, you must have gotten it someplace else because you didn't get it here, even though we didn't give you the mask and what you needed. So enough is enough with the nonsense on that. Another thing that I cannot stress enough, and this actually came up very briefly during one of Secretary Sutter's comments during the governor's update, and that was to have stronger oversight, especially in the nursing homes, the long-term care facilities, in our soldiers' homes as well. You know, we also need to include the hospitals in this. There is not enough oversight to the highest standards of care. We cannot have a CDC acting the way that they have and lowering the standards that have been proven by science to be the most effective. So here we are looking forward to a reopening of everything, and we still have not returned to the highest standards that we know through research have worked and have been very effective. To that same note, the closures of services, essential services that the Department of Public Health has deemed to be essential, has no teeth. So despite the fact that they can say it's essential, that communities need that service, they do not have the enforcement mechanism. We have co-sponsored a bill to give them that teeth, and every community member must be watching very closely, especially at the erosion of services that are needed in the communities of care. So that would be my pitch.
Thank you so much. I mean, all the workers in UFCW, 1199, MNA, you know, you have put yourself at risk to care for us, and you know, we need to make sure that you're not just called essential workers, but not valued, right? And we have to make sure that the employers value you, and we know what that takes. That takes us actually following up and following through. So if we can, you know, we're going to share the MNA website too, and we're going to keep on this and keep the solidarity going and make sure that we're there for you. All of you have been there for us. So thank you so much, Donna. Now we're going to hear from Jerry. You've already kind of touched on some points, but what are some things that we can do to make sure that we're not, you know, just saying that we appreciate you, right? What can we do to show real solidarity for the struggles you're facing right now and workers at 1199 SEIU?
Thanks, Camille. I'm going to cheat just a little bit and answer that question, but give me just a second. I got to piggyback. Don is so right on this. There's two things she raised, which I just want to underline also. One is the decontamination of masks. This is continuing to go on. It's important because to reopen the hospitals and the health systems, they're required to attest that they have adequate supply and a supply chain of PPE. Yet the CDC says the only time you should be using reconditioning or decontamination is when there's a significant shortage. How do you attest that you have an adequate supplies when you're using a process that by definition is for a crisis in supplies? We've got to tackle that and get on top of it. And the other thing I just want to say is the changing standards of the CDC. They flexed their standards, and it's been a tremendous stress on healthcare workers. At one time, the N95 one-use, single-use was the standard. But based, and I've heard Donna talk about this before, based on supply, not on science, the CDC changed that standard. CDC also changed its standards on when someone can come back to work after being exposed or becoming ill with COVID. There's now two standards. One is a two-test standard, which you have to clear 2 tests, and another, the standard that Southcoast Healthcare uses, is a no-test standard, where if you don't have a fever, don't have a cough, you should return to work. We have CNAs who were COVID positive, who lost their fever, but were still symptomatic with things like aches, like exhaustion, which all of the things that people are suffering through, who were demanded or required to come back to work, called to come back to work at Toby Hospital. It's ridiculous. And so the fluctuating standards. We're going to map out over the next month or so a series of actions, folks. There's a home care action will be coming up first, then a nursing home action, and finally a hospital health systems actions. I'm hopeful, and I expect there'll be opportunities for those of us on the Southeast Massachusetts to plug into at least a couple of those, because we don't necessarily have the capacity yet to have an uprising in every one of our healthcare facilities, but they're going to be targeted things. So a little bit of a teaser, but we're going to be putting out a calendar with these events over the course of the next month. The legislative calls, there is a need. All the things that Donna talked about is right. Also the feds, I know it's easy, Massachusetts and Rhode Island, I think, but we got to keep pressure on them. We find it effective, but they need to hear from frontline caregivers. It's fine if all of the people on this call their representatives, but to hear from Joan Monte at Toby Hospital, who suffered with COVID virus because she had no PPE as a CNA, is really impactful. So we're going to keep doing that. Join each other, look for opportunities to meet with us and do this again. Talk about big picture issues. I'm sorry to keep coming back to that, but it is not a movement that we can build unless we're addressing the kinds of issues that workers in this community are facing.
Thank you, Jerry. So I'm going to just read a couple questions and then hand it over to Lisa. And just for folks to know, we can stay past 5:30 if folks want to hang on. Okay, so Debbie Fassino from the Coalition for Social Justice asked a question about if anyone has raised the issue of installing better air filtration systems in buildings to reduce the spread of the virus. And then we have a question from Mary Jane Easton saying the Massachusetts Lieutenant Governor mentioned in one of her COVID-19 updates that Massachusetts was going to partner up with Partners Healthcare. They were going to open up a call center in which the call center workers were going to be taking phone calls from people who have tested positive for COVID-19. The call center worker would then take information from that person to see who would, if they would come in contact with. Does anyone know about this or the air filtration question that Debbie brought up?
Amir?
I'll just jump in. So it's Partners in Health, not Partners Healthcare, that is actually doing it, and it's a tracer program, and it should be very, very effective if it's done right. But there's, like everything else, there's a couple of glitches in it. So what it means is if you have tested positive, you'll be contacted by a worker. A lot of them are school nurses that are not in school right now, so they've been able to do it. And they will ask you a series of questions: where your exposure was, who lives in your household, is anyone else that you know has come down with the same symptoms as you did? And they'll trace that to see where the next impact could be. So it's really kind of following the virus and keeping a very close eye on where the transmission is. So I think that answered that question. And as far as the ventilation, I have not heard enough about the importance of making sure that the filtration systems are increased and advanced. For many of the healthcare workers that are on the line, I'm sure that they will hear me when I say that we know that all the filters are changed when Jaco is walking in the front door. However, I hope that there is a higher standard put in place, knowing how important this is going forward.
Okay, and just one more question, then we'll hear from the president of the Greater Southeastern Mass Labor Council. So Deb would like to know from either Donna or Jerry about stockpiling COVID-19 related medications. Is that something that folks have been advocating for? There have been more discussion about that recently.
No, you don't want to be stockpiling any medication because we don't really know what medications are working. I know that at one point we heard a lot about hydroxychloroquine. Unfortunately, what we found with that is there were more side effects than benefits from taking a medication like that. And we learn something about this virus every single day, so much so that we really and truly need to be very careful to be listening to the science. And just as Jerry said, the science is that, for example, the testing and retesting when someone is going to be returning to work. If you tested positive and you just come back to work, if you haven't tested negative, which was the standard of the CDC, twice, 2 negative tests before you come back, if you're still positive, you're still shedding the virus. You're still a spreader. So really the enforcement of all of those things is critically important.
Could I just jump in for a second?
Now we're going to hand it over to Lisa, but I just wanted to reinforce some comments about how, racial justice obviously isn't just about police interactions with communities of color, right? The labor movement has a long tradition, and it's up to us to really highlight how our work relates to racial justice, how the union difference impacts this, how us pushing for better public health, higher wages is part of the struggle to make Black workers' lives matter, right? So, this call, we're not gonna have enough time to cover all what our unions have done as far as statements, but I think in the future, we want to make sure we integrate that conversation because it isn't really an external conversation, like Jerry said. It's an internal one that impacts our members every day. So with that being said, that's just the beginning of that conversation. We're still in the middle of the pandemic. We need to tackle both of these problems together, and they're not separate, right, from workers' struggle and the labor movement. So with that being said, thank you so much, Lisa, for closing the conversation. We can stay on past 5:30 if people want to continue the conversation, but without further ado, Lisa Lemieux, the president of the Greater Southeast Mass Labor Council. I think there's one more question. I see a hand risen. Aaron, can you unmute Debbie and Jim Pimentel from the Bricklayers Union?
Yeah, you guys are good. Go ahead. You'll have to unmute yourselves.
Go ahead, Deb. I wanted to know about albuterol and medications for sedation. Not really, the other medications she was talking about, stuff we know we need.
Okay, sorry about that. Yeah, I didn't read the full statement, so my apologies, yeah.
I'm glad. Hi, Deb. I have not heard anything about that, but certainly that's something that we should be considering. And the main reason is like so many things we heard in this pandemic, oh, we're running out of this or we're running out of that. And even some of the medications that were being used that were deemed to be effective in the in treating patients with the coronavirus, that really made it very difficult for patients that needed that medication for their own well-being, very difficult. So that's certainly something that we'll include in our conversation going forward, because I think it's very important, especially given that we even heard Tylenol was in short supply for fever control. So I think that's a really good point, and we'll be sure to include that. Thank you.
Thanks for having me. And, I just want to thank everybody for being here with us tonight. And I think that it would be appropriate for us to, say the names out loud of those that have been impacted by the brutality in our country, and just take a moment of silence. And with that, I will say George Floyd, Ahmaud Arbery, Breonna Taylor, and David McAtee, and many more. Thank you. So as we've heard here tonight, It is our union members on the front line who are putting their lives and the lives of their family members in harm's way for our communities and for the country that we all love. We've heard over the last few months that this virus doesn't discriminate, but we know that this is far from the truth because we know that women and our minority communities do not have access to equal and affordable health care. These types of inequities come in different forms. We have hospital systems that are closing locations and units as we speak, like in Falmouth, and have already done so at Toby and Morton Hospital, and I'm sure that more will come. We have closed schools and restaurants, layoffs and furloughs, and all this will disproportionately affect the poorest members of our communities. We know that women earn less, but work the same hours as their male counterparts, but also have to deal with childcare. We know that LGBTQI communities are sometimes treated as second-class citizens. Although we have made progress with our marriage equality bill, it doesn't go far enough, especially when it comes to transgender rights. Racism plays a role in the daily lives of working people. This is a labor issue because it's a worker issue. It's a community issue, and our unions are the community. We must and will continue to fight for reforms and policies and to address issues of racial and economic and social injustices. And we can no longer be silent and say nothing. COVID-19 has actually just shined a light on the inequities. And we must admit that this is a symptom of structural discrimination and systemic racism in our society that was not caused by COVID-19. Everybody's talking about beating COVID-19, but I ask what happens after COVID-19. Are we supposed to go back to normal, back to an unbalanced society? We must find ways to be fair when it comes to affordable housing, education, and expanded healthcare, and we must change minimum wage and paid leave policies across the country as people are nurturing each other on the streets as we speak right now. We cannot just live through this history, but we must change our history. We are one human race. We are one, and we must channel our anger into action by electing leaders who will actually vote in our best interests, like funding the HEROES Act, and not just in the interest of big corporations. Working people need leaders who will have the courage and the determination and the vision to create a better future and work for a profound systemic change that will dismantle the tradition of suppression. So I really want to take the time to thank you all for being here today. Thank you for listening. I have one last statement, and I am quoting our president, Richard Trumka, president of the National AFL-CIO, and that is that our collective bargaining agreements are not a shield from misconduct. And so for me, that has been something to think about. As Jerry has mentioned, I'm learning a lot through this process that we're going through right now, and I'm sure I will continue to learn more. But I wouldn't want to be doing this without each and one of you that's here. I've enjoyed working with every single one of you and hope to do more of that in our future. May God bless you and keep you all safe. Thank you.
Thank you, Lisa. You as well.
Thank you.
All right, appreciate everybody who's been here. It's been a great conversation, and we need to keep having these. So thanks everybody who spoke and for the great questions, and we'll see you all again.